Trouble with sleep after a stroke is a common but often overlooked issue, but it shouldn't be. Did you know that almost 41% of stroke survivors deal with insomnia? Survivors are also much more likely than the general public to deal with trouble with breathing while asleep. And sleep is necessary to promote healing after a stroke. So today, we're going to talk about what you need to know so that you can sleep better tonight. Let's get into it. If you learn nothing else from this video, remember this. Most stroke survivors don't know that sleep apnea is the most common cause of disordered breathing during sleep after a stroke. It's estimated that anywhere between 43 and 70% of stroke survivors are dealing with obstructive sleep apnea, and that's compared to only 4 to 24% of the general population. That's a huge difference. The first thing that you need to do is take stock. Are you showing symptoms of sleep apnea? And those can be a wide range of things, from excessive daytime sleepiness and fatigue, snoring, waking up in the middle of the night coughing or choking, or having a decreased blood oxygen saturation. One of the best things that you can do to get better sleep is to develop a good sleep routine. And this can include a lot of different things. So for example, it might mean that you get moving more during the day. Using up your energy throughout the day will prepare your body for sleep because you're actually going to be tired enough. Go to bed and wake up at the same time every day. And I know that this is a hard one to do, but by sticking to a sleep schedule, your body will kind of learn when it's time to be tired. Keep screens out of your bedroom. The blue light from our phones, computers, and televisions stimulates our brain to think that it's daytime, and it makes us more alert and less tired. Keep your bedroom cool and dark. But if you're like me and you have some light that comes into your bedroom at night, try wearing a sleep mask. I've actually been using one recently that I'm really happy with, and I will leave a link to it down in the description below. Last but not least, to include in your sleep routine is potentially medications. There's no shame in that game. It's a good idea to talk to your doctor about what's going to be best for you in your situation. Sometimes something like melatonin, which is an over-the-counter medication you can take, will be enough. Other times you may need a prescription sleep aid to help you sleep. But regardless, at some point, we all just need a good night's sleep, and there's no shame in taking medication. Pain and discomfort can keep you from sleeping as well, but using positioning strategies, whether you like to sleep on your back, on your affected side, or your unaffected side, can be helpful to give you a better quality and quantity of sleep. So let's go ahead. I'm going to walk you through the positioning for sleeping on your back. Now, one little thing to note, in the early stages after a stroke, lying on your back isn't recommended because it can sometimes encourage spasticity to develop. However, we know that people like to lay on their back. So if you're going to do it, here's the position you need. 1 or 2 pillows under your head, whatever is more comfortable. And you may need a care partner to help you get into this position if doing this yourself is too difficult. So we are going to have 1 pillow under my head. I am using the second pillow here, and that's going to go all the way under my affected arm, all the way up under the shoulder to really give that level of support. If you can, you want to try to get your arm out and away from your body with your hand, your palm turned down. Now, the other thing you want to do is take a small pillow and try to get it under the buttock or your affected hip so that when you're laying flat, your hip is not going to roll outward, so that it's not going to go into rotation and potentially put a strain on the hip joint. So that's positioning for laying on your back. And to lay on your affected side, we're going to start in the same place. We're going to have 1 or 2 pillows under your head. And for the purpose of this demonstration, now this is my affected side. Your arm is going to come out beside you, and you're going to try to get it as straight as you can. You can support it on a pillow if you want to. Now, your affected leg is going to go behind. Unaffected is going to cross and come over and rest on a pillow. Let me show you. So as you can see, affected arm is out towards the front. Unaffected arm is just coming over the side as well. I have a pillow here that's supporting my arm and shoulder. My unaffected leg is crossing over the top, and I have a pillow underneath to support it. This can also help me to keep me from rolling all the way over. And then affected leg has come to the back just slightly. Now, again, with this position, you can also put a pillow behind your back or your loved one's back to keep from rolling backwards. Now, to lay on your unaffected side, here's the positioning you're going to need. And for the purpose of this demonstration, this is my unaffected side. So again, a pillow or two under your head, whatever is more comfortable. You're going to get on your side. So to reiterate, this is my affected side. I'm lying on the unaffected side. You're going to put a pillow out in front, and your affected arm is going to come out and over. You're gonna try to get it a little bit straighter, and your shoulder is gonna be pushed forward and try to get your fingers out. But the pillow is gonna be underneath to support. Now for legs, unaffected leg is going to come forward just slightly. Affected leg is going to go back and is going to be supported on a pillow from the groin all the way down to the foot or the ankle. So I'm gonna get into position just to show you. And you may also consider putting a pillow behind your back or your loved one's back just to keep them from rolling over during the middle of the night. All right, everyone, that's it for today. If you would, I would love it if you'd leave me a comment down below and let me know, what are some strategies that you have used to help you sleep better? And as always, I am leaving a link down in the description if you would like to sign up for my email list. It gets you free stroke recovery tips and motivational emails, as well as a free copy of my ebook, The Stroke Recovery Pocket Guide. Thank you all so much for watching. I'll see you next time.